We're now going to transition into neurodegenerative and demyelination disorders as part of our conversation surrounding neurology. And we'll first talk about Alzheimer's disease, which is a progressive neurologic disorder. And this is characterized by the accumulation of misfolded proteins in the brain. And now there's lots of different hypotheses of kind of the pathophysiology. And there's actually been some newer studies out that somewhat confront some of the prior known knowledge, but for NPLEX 1, this is kind of the pathophysiology that we'll lean into. So, with Alzheimer's disease, there's an accumulation of misfolded proteins in the brain. That's what's been hypothesized that leads to dysfunction in the synapses, loss of neurons, and cognitive decline. It's the most common cause of dementia in older adults, and it really affects the hippocampus, temporal and parietal regions of the brain, and the frontal cortex in the later stages. There are some genetic factors, especially with early onset familial Alzheimer's disease. This is a rare autosomal dominant disorder involving the APP, the amyloid precursor protein, which is a gene on chromosome 21. It also has been associated sometimes with PSEN, the presenilin 1 or 2 gene, which is on chromosome 14 or 1, respectively. In late onset Alzheimer's disease, this is more polygenic and multifactorial. There may be a ApoE4 allele where the apolipoprotein E on chromosome 19 is damaged and increases risk and lowers age of onset. And there's lots of environmental factors to consider: head traumas, vascular disease, education level, physical inactivity. Many of these may influence disease risk, but do not directly cause the disease. Now, some of the pathophysiology is these A beta peptides are produced from cleaving amyloid precursor proteins, or APPs, by beta secretase or base 1 and gamma secretase. This leads to an A beta 42, which is a longer, more aggregated protein. That forms an insoluble plaque that then deposits in the cerebral cortex and the hippocampus. And A beta accumulation is neurotoxic. That's what disrupts synapses. It triggers microglial activation and chronic inflammation, and it impairs neurovascular integrity. Uh, Neurofibrillary tangles is another kind of pathophysiologic component of Alzheimer's, and these are composed of hyperphosphorylated tau proteins that typically their normal function is to stabilize microtubules, but when they're hyperphosphorylated, they become also insoluble and they form paired helical filaments and these tangles, which leads to disruption in axon transport, cytoskeleton collapse of cells, and ultimately neuron cell death. There are some other pathophysiologic mechanisms like the cholinergic hypothesis, which says that a significant loss of cholinergic neurons in the basal forebrain or the nucleus basalis can contribute to cognitive defects. Neuroinflammation hypothesis, where activated microglial cells and astrocytes release pro-inflammatory cytokines, leading to neuron injury, and oxidative stress and mitochondrial dysfunction that lead to impaired protein clearance, impaired autophagy, and ubiquitin proteasome pathways, which then also exacerbate neurodegeneration. There's some modifiable risk factors, including cardiovascular disease, traumatic brain injury, the cognitive reserve hypothesis with education, depression, social isolation, sleep, especially obstructive sleep apnea, and then smoking and alcohol intake. The non-modifiable risk factors are age, the most significant risk factor as it doubles every 5 years after 65, genetics, the ApoE4 allele, and family history, especially in first-degree relatives, as well as sex. AFAB individuals typically are more affected than AMAB individuals, partially due to longevity. In early stage, there's subtle short-term memory loss and challenges with word finding, which is anomia. There may be some impairments with executive functioning, like planning and organization, and typically preserved insight and independence in our ADLs. In the moderate stage, there's worsening memory loss and disorientation of time and place, challenges with complex tasks and mood changes like apathy, depression, and anxiety, as well as behavioral symptoms like agitation, irritability, and delusions, as well as visuospatial defects or deficits, which like kind of getting lost. In late stages, there's pretty profound cognitive impairment and loss of language skills, aphasia, and motor deficits like gait disturbances and rigidity. There can be incontinence or even complete dependence with ADLs and symptoms like mutism, stupor, or a bedbound state. Complication would be functional decline, a progressive loss of independence, malnutrition, or dehydration, certain infections, especially aspiration pneumonias and UTIs, falls and pressure ulcers, and then there can be some neuropsychiatric complications, as well as caregiver burden is huge. Ultimately, death can be an outcome often from infection or malnutrition.